Here's something most people never get told at their doctor's office. Your blood pressure isn't just a heart problem, it's also a brain problem. Deep in your brainstem sits a control center called the RVLM, the rostral ventrolateral medulla. Think of it as a thermostat for your entire cardiovascular system. It receives signals from pressure sensors in your neck arteries called baroreceptors, and it uses those signals to decide whether to raise or lower your blood pressure. When those sensors work well, your pressure stays balanced automatically. But as we age, our artery walls stiffen. And when the walls stiffen, those sensors can't stretch and fire properly. The thermostat loses its signal, so your brain, interpreting silence as danger, defaults to keeping your pressure elevated all day, every day, even when you're perfectly calm. This is called baroreceptor reflex impairment, and research suggests it plays a role in why some people with hypertension don't respond fully to medication alone. Now here's the good news, and this part is backed by real clinical research. There's a technique called isometric hand grip training, and it's been studied for over 2 decades. A 2013 meta-analysis published in the Journal of Hypertension found that regular isometric hand grip exercise reduced systolic blood pressure by an average of 10 points. The American Heart Association has listed it as an evidence-based adjunct therapy for hypertension. Here's how it works. When you squeeze something firmly, a towel, a tennis ball, even your fist, at about 30% of your maximum effort for 30 seconds, you restrict blood flow to your forearm. Your muscles start burning through oxygen, metabolic byproducts build up. Then, when you release, blood floods back in at 3 to 4 times its normal speed. That surge creates what's called shear stress on your artery walls, a friction force that triggers your endothelial cells, the thin lining inside your blood vessels, to produce nitric oxide. Nitric oxide is your body's natural vasodilator. It tells your arteries to relax and open up. And when your vessels are more flexible and compliant, your brain's pressure control system senses that things are working well and gradually begins to lower its baseline output. The protocol that's been tested in studies is simple. 4 rounds, alternating hands, 30 seconds of squeezing, 30 seconds of rest, done twice daily, 8 weeks. That's it. No special equipment, no side effects, just a documented physiological response that works with your body's regulatory system instead of around it. Now, this doesn't replace your medication, and you should never change your doses without talking to your doctor. But if you've been frustrated by blood pressure that spikes in the afternoon, surges in the morning, or never quite settles, this is one tool, grounded in real science, that might make a meaningful difference. The body knows how to regulate itself. Sometimes it just needs the right signal to remember. Try it tonight. Squeeze, release, breathe, and start tracking your numbers.